Most people are unaware that pancreatic cancer is one of the most lethal cancers in the world, quietly claiming more lives each year than several other high-profile cancers combined. It has earned a reputation among medical professionals as a silent threat because it often advances without obvious early warning signs. What makes this disease particularly frightening is how it hides in plain sight. Many of its initial symptoms are so subtle that they're mistaken for everyday health issues, only to be recognized when the cancer has already spread. The pancreas, a small organ tucked deep in the abdomen, is vital for digestion and blood sugar regulation. Because of its hidden location, tumors can grow unnoticed, buying the disease precious time to advance. In the United States alone, pancreatic cancer claims tens of thousands of lives annually. Globally, the numbers are climbing, yet public awareness remains surprisingly low compared to other cancers. Research indicates that many symptoms can appear 3 to 6 months before a diagnosis. This creates a critical window for detection if people know what to look for. Today, we'll explore 8 surprising symptoms of pancreatic cancer. Signs that, when recognized early, could mean the difference between life and death. We'll also share why some of these symptoms are dismissed so easily, and how medical studies show that noticing just 3 of them together can significantly improve the chances of early detection. Let's begin with the first warning sign, one that impacts a basic function we often take for granted: digestion. Digestive changes can be one of the earliest red flags. The pancreas produces essential enzymes that help break down fats, proteins, and carbohydrates. When a tumor disrupts this process, digestion suffers. You might notice persistent bloating, nausea, or even vomiting after meals. Over time, this disruption can cause a noticeable decrease in appetite, leading to unintentional weight loss. Another key sign is a change in stool appearance. When fat isn't broken down properly, stools can become pale, greasy, and unusually foul-smelling, a signal that your digestive system isn't functioning as it should. These aren't just minor inconveniences. They're potential alarms from your body, pointing to an underlying problem that needs urgent medical attention. By paying attention to such digestive shifts and understanding their connection to pancreatic function, you give yourself a fighting chance at catching this disease early. The second warning sign is persistent fatigue or physical weakness. This isn't the kind of tiredness you feel after a late night or a busy week. It's a deep, lingering exhaustion that doesn't fade, no matter how much you rest. Cancer cells consume large amounts of energy as they multiply, stealing nutrients from healthy cells. Over time, this drains your body's reserves, making even simple daily activities feel overwhelming. Many patients describe waking up after a full night's sleep still feeling exhausted. Climbing stairs, walking short distances, or even lifting light objects can suddenly feel like monumental tasks. This physical decline often comes with emotional challenges, feelings of frustration, sadness, or anxiety that make recovery even harder. Sleep disturbances are common, trapping patients in a cycle of both mental and physical strain. What makes this symptom dangerous is how easily it's misattributed to stress, aging, or overwork. Unlike normal tiredness, this fatigue lingers and gradually worsens, making it an important early warning sign. The third sign is fever and shivering. While fevers are common with infections, pancreatic cancer-related fevers behave differently. They can appear in cycles, with episodes of intense chills followed by sudden spikes in temperature. These temperature swings happen because the pancreas may become inflamed, prompting the immune system to react. The situation can worsen if the bile duct is also blocked, adding further strain to the body. Unlike typical viral fevers that resolve within a week, these temperature changes can persist or recur for weeks, sometimes accompanied by night sweats and a general sense of being unwell. The fourth warning sign is one many wouldn't associate with cancer: blood clots. Pancreatic cancer can trigger a condition called hypercoagulability, which means your blood clots more easily than normal. These clots most often form in the deep veins of the legs, a condition known as deep vein thrombosis, DVT. Symptoms can include swelling, warmth, tenderness, and a reddish or bluish skin tone in the affected area. The danger is that if a clot breaks loose, it can travel to the lungs, causing a pulmonary embolism, a medical emergency that can be fatal within minutes if not treated. The link between pancreatic cancer and excessive clotting comes from inflammatory chemicals released by the tumor, which disrupt the body's natural clotting balance. Recognizing sudden leg swelling or unexplained shortness of breath as potential clot-related emergencies could save lives, especially in those already at risk for pancreatic disease. The fifth warning sign is swelling of the gallbladder or liver. These organs work closely with the pancreas, so when a tumor develops, the effects can ripple outward. One common cause of swelling is a blocked bile duct. This duct normally carries bile from the liver to the small intestine, but a tumor can obstruct the flow, causing bile to back up. When bile accumulates, the gallbladder, normally about the size of a small pear, can enlarge significantly. This swelling can sometimes be detected during a physical examination. The liver may also become enlarged as bile builds up within it. This can create discomfort or a sense of fullness beneath the right rib cage. Modern imaging tests, such as CT scans or ultrasounds, can reveal these changes clearly. For doctors, an enlarged gallbladder or liver can be an important clue pointing toward a pancreatic problem. Understanding how closely these organs are connected helps explain why one issue can set off a chain reaction affecting the others. The sixth symptom to watch for is gas or persistent bloating. While many people experience occasional bloating, pancreatic cancer can cause it to become frequent and stubborn. The pancreas produces enzymes that break down fats, proteins, and carbohydrates. When a tumor interferes with this process, digestion slows and bloating becomes more noticeable. A particularly telling sign is early satiety, feeling full after eating only a small amount. This can happen because the tumor presses against nearby organs, limiting space for food. Unlike normal bloating that fades after a few hours or with dietary changes, bloating linked to pancreatic cancer tends to be persistent and resistant to common remedies. The abdomen may appear swollen even when you haven't eaten, and the discomfort can last all day, sometimes accompanied by mild nausea. These symptoms are often brushed off as stress, indigestion, or just getting older. Unfortunately, such assumptions can delay diagnosis until the disease is far more advanced. If bloating, fullness, or abdominal tightness continues for weeks without a clear cause, it's worth getting checked because it could be more than just a digestive nuisance. The seventh warning sign is tummy or back pain. While abdominal discomfort is common for many conditions, the location and nature of pain linked to pancreatic cancer can be distinctive. When tumors form in the body or tail of the pancreas, they can press on nearby nerves and organs, causing a deep, dull ache in the upper abdomen. This pain often radiates through to the back, creating a band-like sensation across the torso. Some patients describe it as annoying or constant pressure. The discomfort can worsen after meals or when lying flat, making sleep and daily activities increasingly difficult. At first, the pain may come and go, providing short periods of relief. But as the disease progresses, it usually becomes more persistent and more severe. Doctors often pay close attention to the timing, location, and quality of pain to help distinguish pancreatic cancer from other digestive or musculoskeletal issues. The eighth and final symptom is dark yellow or brown urine, a change that many people dismiss as dehydration but can signal something far more serious. Pancreatic cancer often blocks the bile duct, leading to a buildup of bilirubin, a yellowish substance formed during the breakdown of red blood cells. When the liver can't release bilirubin into the intestines, it's excreted through the urine, turning it a dark yellow, amber, or even cola-like shade. This color change can appear days or weeks before other signs of jaundice, such as yellowing of the skin or eyes, making it an important early clue. If your urine remains dark despite drinking plenty of water, it's worth seeking medical attention promptly, as this could indicate a blockage that needs urgent evaluation. Changes in urine color can be subtle at first, but when combined with other symptoms like fatigue, digestive issues, or unexplained pain, they can form a clearer picture of an underlying problem. By being alert to such changes, you may catch pancreatic cancer earlier, when treatment options are more available and outcomes can be better. We've now covered the 8 critical symptoms of pancreatic cancer that everyone should know: digestive changes, persistent fatigue, fever and shivering, blood clots, swelling of the gallbladder or liver, gas and bloating, tummy or back pain, and dark yellow or brown urine. Individually, these symptoms might seem harmless or easy to explain away, but together they can paint a much more serious picture, one that deserves immediate medical attention. The challenge with pancreatic cancer is its ability to disguise itself as minor, everyday health issues. That's why awareness is one of the most powerful tools we have. Medical research shows that recognizing even 3 of these symptoms occurring together can significantly improve the odds of early detection. Early detection matters because pancreatic cancer is far more treatable in its initial stages. Once it spreads, options become limited and the prognosis becomes much more serious. If you've noticed these signs in yourself or someone close to you, don't wait. Seek a professional medical evaluation. It could make all the difference. Understanding the connection between these warning signs and pancreatic function gives you an advantage most people don't have. It turns awareness into action. Even if you feel healthy, sharing this knowledge can be life-saving. You never know who in your circle might be experiencing these symptoms and dismissing them. The pancreas is small and hidden, but its role in your health is massive. When it sends warning signals, they should never be ignored. By keeping these 8 symptoms in mind and taking them seriously, you can help fight one of the most aggressive cancers known today. Your health is worth protecting, and sometimes a simple piece of information can be the spark that changes everything. If you found this video helpful, please consider subscribing to Healthy Front. We're dedicated to sharing critical, science-backed health information that can save lives. Turn on notifications so you never miss an update, and share this video with friends and family, because awareness today could mean survival tomorrow.